Bismillahirrahmanirrahim. Hadith of the day. The Prophet, peace be upon him, said, for him who follows the path for seeking knowledge, Allah will ease for him the path of paradise. Assalamu alaikum, everyone. I am Dr. Marina Akhtar, PGR Community Medicine. Today, my topic of presentation is Disease Early Warning System, DEWS. Learning outlines, disease surveillance, disease early warning system, component of the disease early warning system, DEWS Pakistan, electronic disease early warning system, EDEWS, early disease alert and reporting network, EWARN, recent updates, and the MCQs in the end. In the end of presentation, the participants would be able to describe the important aspects of the disease early warning system, DEWS, and early warning alert and reporting network. Disease surveillance. Surveillance is ongoing systematic collection, analysis, and interpretation of data, dissemination of information to those who need to know in order that action may be taken. Type of public health surveillance. There are two types of public health surveillance, passive surveillance and active surveillance. In passive surveillance, diseases are reported by healthcare provider, and in active surveillance, health agencies contact health providers seeking reports. Passive surveillance is simple and inexpensive. Active surveillance ensures more complete reporting of the condition, and in passive surveillance limited by incompleteness of the reporting and variability of quality, and active surveillance used in conjugation with specific epidemiological investigation. Both type of surveillance have uses. Passive surveillance may give you the information you need for future planning, but active surveillance is what is that DEWS is most used for detecting cases of disease we are concerned about and dealing with them before they get worse. Objective: to ensure timely detection, response, and control of the outbreak by the early detection at the local level by time, place, and clustering of the cases among IDPs and resident population. To monitor trends of communicable disease in order to take appropriate public health action. To estimate workload of the different health units involved in the system. To rationalize resource allocation. Disease Early Warning System. Disease Early Warning System, DEWS, is a program by which health worker can detect sign of an epidemic at an early stage in order to prevent its occurrence or expansion. It is cost-effective and sustainable program, especially in the developing countries like Pakistan, where infectious disease causes a significant magnitude of morbidity and mortality in country. Main characteristic of the system: very sensitive, detect all the possible cases. It is simple, good acceptability among all health personnel. Short periodicity of reporting, detect sudden increase of cases. Component of the DEWS: climate forecast and ongoing epidemiological surveillance and environmental observation that leads to disease watching and warning, risk analysis, vulnerability assessment, and response strategy that then leads to public communication and evaluation and feedback. Environmental observation. Systematic climate observation are an important component of an early warning system, and new remote sensing technologies for monitoring ecological parameters such as soil moisture, vegetative cover, and sea surface temperature on a global scale inevitably play an important role in disease early warning system. Vulnerability assessment. Vulnerability refer to a population's sensitivity to a hazard as well as its ability to cope with hazard. Vulnerability assessment provides a context for interpreting surveillance data and for understanding the impact of disruption among any of the links that connect nutrition, shelter, economic system, and human health. Risk analysis. Risk analysis is carried out by assigning specific probabilities to likely impact of the impending hazard. Risk is a complex variable related to hazard types and pattern of vulnerability, possible impact of the hazard events, and the capacity of the communities to absorb and recover from these impacts. Preparedness or response. Warning system must be developed in concert with the development in local, national, and regional level response capabilities, particularly in highly vulnerable areas. Public communication. To ensure that warning information and recommended response strategies are headed by population at risk, effective public communication strategies must be developed. Progression of the types of information that can be used to indicate an impending disease outbreak. Certainty and the prediction and surveillance, climate, first of all, climate forecast, then environmental observation, and then in surveillance include sentinel animals and early detection of early cases and detection of epidemic. Dues in Pakistan to minimize morbidity, mortality due to communicable disease by detecting epidemics at their earliest possible stage. World Health Organization (WHO) is in collaboration with the Ministry of the Health and National Institute of the Health established the first national weekly reporting based surveillance system called Disease Early Warning System (DEWS) in Pakistan. The Disease Early Warning System was introduced in the immediate aftermath of the 2005 earthquake in Pakistan with the objective to undertake the prompt investigation and mitigation of the disease outbreak. The system has now expanded to cover about 107 million people or 57% of the Pakistan's population. Function of DEWS. The DEWS is effective in its core function of alert detection and early outbreak containment. Its approaches for outbreak detection include immediate alert reporting, investigation, timely response, weekly data collection on several syndromes from more than 3,000 health facilities in 5 provinces of Pakistan. Goal. Its goal is to reduce morbidity and mortality by early detection and response to epidemic-prone disease, and its objectives are report weekly disease trends from countrywide sentinel sites, and respond to alert within 24 hours and control outbreaks, including water quality, sanitation input, clinical case management, and health promotion as needed. Disease selected for DEWS. Acute flaccid paralysis, polio, plague, dengue, malaria, measles, typhoid, viral hepatitis, diphtheria, pertussis, neonatal tetanus, influenza, and HIV/AIDS. Electronic Disease Early Warning System, EDUS. The Electronic Disease Early Warning System, EDUS, an initiative that promotes the use of the data and information system standards to advance the development of the efficient, integrated, and interoperable surveillance system at federal, provincial, and district levels. Primary goal of EDUS: to capture data using mobile software and secure automatic electronic transmission and analysis of the data, alert generation and dissemination of information to main stakeholders, and to facilitate identification of the national public health threats more promptly, more timely, and accurate disease reporting, and provide platform to facilitate integration of the disparate reporting system. DEWS weekly flow if OPD on Friday to Thursday, then to health facility, this information goes to district on Friday, then next Friday DEWS SO as to Saturday, this information go to provincial hub, and the next Saturday to and the Saturday to the national level, and the Monday report is generated. And this is the conversion of the paper-based DEWS reporting form into mobile phone and the web-based application. Disease early warning system, key aspect of 2010 Pakistan flood response. It affected this affected more than 20 million people, covered 1/5 of the country territory, and more than 8 million people are displaced. Dues are initially put in place in 37 district judge earthquake and the flood prone, with the aim to expand it to other high risks. At the onset of the emergency, USAID and WHO expanded the system rapidly. Within 2 weeks, the Dues network had more than triple its coverage, and the number of the patients seen in the medical facilities increased sixfold. And recognizing the danger of the epidemic outbreak, diarrhea treatment centers were established immediately in the most at-risk districts, setting up to 63 centers in 41 districts. In 3 months, more than 60,500 patients were treated and 15,000 were admitted for long-term care at, and among those admitted, only 58 diarrhea-related deaths were recorded. In this picture, there is shown the flow of information and timing of the reports for dues in flood affected areas in Pakistan. From the health facilities reporting by 4 p.m. same day into the district, and the district reporting 4 p.m. same day to the province, and province reporting at the 10 a.m. next day to the central, and the central AP bulletin published at 4 p.m. next day. This picture showing the dues reporting forms. Early warning alert and response network, EWARN. An early warning alert and response network, EWARN, is a network of the health partner that collect and report surveillance data on the selected epidemic prone disease as a part of establishing an early warning system for disease outbreaks in humanitarian situation. It is usually so-called syndromic surveillance system, whereby any unusual events or disease occurrence is monitored and rapidly investigated. In such surveillance system, each disease is diagnosed on basis of the case definition. For each of the epidemic disease, a threshold value for alert of an outbreak is set. Whenever the threshold is passed, the system flags the events for rapid investigation. Component of EWARN: alert component, reporting component. In alert component, an immediate alert component signals the early stages of the outbreak, which requires the immediate investigation for verification. In the reporting component, a weekly reporting component aggregate data from the from health facilities to provide information on disease trends for priority health conditions. Countries with functioning EWARN system. WHO health partners and ministers of the health implement EWARN together in countries that face humanitarian crises. Currently, 7 countries in the region which are facing protracted emergencies have established a functional EWARN system. These countries include Afghanistan, Iran, Libya, Somalia, Sudan, Syria, and Yemen. The Global EWARN Project, an initiative to strengthen the early warning alert response in emergency. These include support Minister of the Health and partner that include feed-based tools, training, and technical support that includes online desktop and mobile application that can be rapidly configured and deployed. The aim is to reduce cases and death that occur during emergencies. EWARNs in a box, everything you need in the field. EWARNs is in a box, a kit containing the essential equipment needed to establish surveillance and response in emergency. This requires mobile network coverage. This does not require 24-hour electricity supply or internet connection. This kit contains transport and security, data hosting and storage by data hub, and data collection by mobile and laptop, and the power supply by a solar charger. One kit can support early warning, alert, and outbreak response. eWords is made up of three components: data hub, mobile, and exchange. How does it work? It works by data collected offline in eWords mobile, then data received in real time in data hub is at subnational level, and three is data hub synchronized data to the country level, and fourth is immediate alert and feedback shared with field users when needed, and then final step is data analyzed and shared for rapid action, system updated, and data sharing moderated via exchange. eWards in a Box. Since 2015, eWards in a Box has supported over 100 million emergency affected population across regions with early warning of the disease outbreak, with the response when outbreak were detected. For example, cholera, measles outbreak, early warning around a specific disease outbreak, Ebola, hepatitis A outbreak. Key areas of eWords in Box: data collected from various sources, primary health care, and from the community, alerted to disease outbreak, interactive alert management between the field and the surveillance officers, use standard case of definition, use standard alert threshold, systematic generated alert for increasing trends and seasonal increments, and the response, interactive response with field surveillance office, lab, and response team. How to get eWords in a Box support in a crisis. When there is emergency situation, it send request for support from eWords support team. Then in next step, rapid discussion between the eWords core team and the local stakeholder that leads to rapid deployment of the eWords in the box kits and support staff, and that leads to establish electronic early warning, that leads to tools for local training and capacity building, and then leads to continued support during the entire emergency periods, and in the end technical support for the reintegration to routine surveillance. Now coming to the recent updates. Assessment. Our first article is assessment of the electronic disease early warning system for improved disease surveillance and outbreak response in the Yemen. Disease surveillance is the continuous process of the data collection, data interpretation, and dissemination of information for swift public health action. This study aimed to assess the performance of the National Electronic Disease Early Warning System in the Yemen using system attribute data quality, timeliness, stability, simplicity, predictive value, positive sensitivity, acceptability, and flexibility, and representativeness based on the Center of the Disease Control and Prevention CDC standard indicators. A method is performed by mixed method, qualitative and quantitative. Both data are collected, and the finding of this assessment show that eDuce is resilient and reliable system despite the conflict in Yemen. The system is still functioning and expanding. Conclusion of these studies is the quality and timeliness of response are major challenges to eDuce functionality. The eDuce remain the only system that provide regular data on communicable disease in Yemen. In particular, public health response timeliness needs improvement. And the second article is intelligent, portable, and cost-effective eye disease early warning system based on developed pupillary dynamic data set with machine learning. Human pupil response dynamics to variable illumination stimuli may lead to the prediction of the cephalic autonomous nervous system integrity. In this paper, the sensitivity of the multiple discrete wavelength on the human subject's eye has been measured as input light was focused. Consequently, the exclusive pupillary dynamic data set having 15-second pupil dynamic response video has been developed for 66 Asian human subjects with the age variation 18 to 48. The time has been recorded from the transient state of the pupil diameter until it is stabilized under steady state. This unprocessed data set has been efficiently enhanced in the quality to detect the circumference of the pupil using video processing algorithms and bandarization, adaptive thresholding, morphological process. And the data set was used to train and test the machine learning model with logistic regression approach. The prediction accuracy of 94% has been achieved to identify a healthy and normal functional eye. A repeatability of 90% has been obtained to predict the true positive and true negative test case. Consequently, an intelligent, cost-effective, and portable eye disease early warning system has been prototyped and presented in this work. Now coming to our MCQ session. MCQ number 1 is: surveillance is ongoing systematic collection, analysis, and interpretation of the data and dissemination of information to those who need to know, in order that action may be taken. For which type of surveillance DUSE is mostly used for? Option A, active surveillance. Option B, passive surveillance. Option C, sentinel surveillance. Option D, routine surveillance. And option E, direct surveillance. Anyone want to answer this? Answer is option A, active surveillance. In a remote region, local health authorities notice an unusual number of the patient with severe diarrhea and vomiting present in the multiple clinic within a week. Given the resources are limited, which immediate action should the DUSE prioritize? Option A, conduct a region-wide vaccination campaign. Option B, dispatch health team to assess and confirm cases in the community. Option C is launch a media campaign to warn tourists. Option D, document the symptoms for later statistical analysis. Option E, focus solely on the lab testing without further data collection. The answer is option B, dispatch health team to assess and confirm the cases in the community. MCQ number 3 is: our DUSE system in an urban areas has detected a spike in flu-like symptoms at several health facilities. Laboratory testing confirm a new strain of influenza. What should be the next step to prevent a widespread outbreak? Option A, monitor social media for potential rumors. Option B, benign vaccination and last year flu vaccine. Option C, isolate affected patient, promote hand hygiene. Option D is report the case only if they continue to rise. Option E, wait for confirmation for a neighboring region. The answer is option C, isolate affected people and promote hand hygiene. MCQ number 4 is: in a region with limited access to the healthcare, DUSE detect a pattern of the fever and rash among the children in several districts. Lab testing has not yet confirmed a specific pathogen. What should the DUSE official focus on the control of the situation? Option A, collect the travel history of the affected individual. Option B is issue public health warning and start isolation protocol. Option B, wait until case spread further for more data. Option D, advise families to avoid all physical contact. Option E, only report cases that non-travel histories. Answer is option B, issue public health warning and start isolation protocol. After Eid celebration, the DUSE in Pakistan detect a rise in gastrointestinal illness cases in a densely populated area. Suspected cases include flood contamination during large gathering. How should the DUSE official respond to prevent further spread? Option A, focus on providing treatment only to those already showing symptoms. Option B, close down all food vendors in the area without investigation. Option C, limit health education effort to restaurant only. Option D, wait to determine if cases increase further before acting. Option E, issue public advisories on the safe food handling and recommend medical attention for severe cases. Answer is option E. MCQ number 6 is: in the rural areas of Balochistan, the DUSE has flagged a rise in children presenting with acute watery diarrhea, dehydration due to limited access to the healthcare facilities. What should be the first step of the DUSE to prevent a large-scale outbreak? Option A, set up the mobile clinic to provide oral rehydration therapy and to educate on hygiene practice. Option B is focus solely on transporting patient to the nearest city hospital. Option C, begin a public health survey without providing treatment. Option D, wait for the symptom to subside before taking action. Option E is limit intervention to major urban center only. Answer is option A. MCQ number 7 is Jews in Pakistan flags the unusual number of the cases with symptoms of the viral hepatitis in a village after a community event. Resources for the widespread testing are limited. What should be the immediate action by Jews to control the outbreak? Option A, provide health education on hygiene, ensure safe drinking water, and isolate symptomatic individual. Option B, wait for the confirmation before issuing any public advisories. Option C, advise the village to halt all public gathering without further action. Option D, implement blanket vaccination for all villagers. Option E, conduct extensive lab tests in all attendees of the community events. Answer is option A, provide health education on hygiene and ensure the safe drinking water and isolate symptomatic individuals. MCQ number 8 is some areas of Pakistan were hit by flood in 2010. There was a daily reporting system by dues in the blood crisis. All health facilities reporting data daily too. Option A, district surveillance coordinator. Option B, provincial surveillance officer. Option C is central surveillance coordinator. Option D is bulletin publisher. Option E is national surveillance coordinator. The answer is option A, district surveillance coordinator. MCQ number 9 is the dues in the Karachi record a rise in dengue-like symptoms in the hospital across the city during the rainy season. With limited hospital beds and resources, what immediate measures should the dues prioritize? Option A, conduct mosquito fogging in high-risk areas and encourage the use of insect repellent. Option B, wait for the more cases to be confirmed before taking action. Option C, close schools to prevent further transmission. Option D is only provide symptomatic treatment without community outreach. And option E is administer a vaccine in all resident immediately. Answer is option A. MCQ number 10 is a new highly contagious respiratory illness is spreading in the multiple communities. Testing and the treatment facilities are limited. Which of the following should use focus on the effectively contain the disease? Option A, encourage social distancing and limit public gathering. Option B, restrict only high-risk patients from moving. Option C, distribute personal protective equipment solely to the healthcare worker. Option B, wait for a vaccine to be developed. Option is focus on the quarantine for travelers only. Answer is option A, encourage social distancing and limit public gathering. This is the key of MCQs. These are the references of my presentation, and this is the YouTube link of our channel where all presentations are uploaded. Kindly like and subscribe, and thank you.